Clinical depression is a disorder characterized by severe and overwhelming sadness and despair, as well as lack of energy and little interest in social contact. This mental disorder is biologically caused by three neurotransmitters: serotonin, dopamine, and norepinephrine. These neurotransmitters are in control of the human emotions, which is why they are such a big part of clinical depression. Serotonin controls mood, sleep, appetite, and function, and patients with clinical depression usually have low levels of serotonin in their system. Dopamine is known as the feel-good neurotransmitter, which usually makes a person feel happy. Patients diagnosed with clinical depression usually have a deficiency in dopamine. Norepinephrine is known to be in control of characteristics of social relationship. So people who suffer from depression usually have a dangerously low level of norepinephrine. Usually people who are diagnosed with clinical depression are usually seen by psychiatrists to help them determine if a patient is clinically depressed through a series of medical evaluations. Psychiatrists usually get a record of family psychiatric history and ask personal questions. There is not an actual medical test, such as blood tests or such, to diagnose clinical depression. Doctors may run blood tests to see if there's another factor contributing to the depression, such as hypothyroidism or substance abuse. Doctors usually prescribe antidepressant medications and recommend psychotherapy such as cognitive behavioral therapy. Depending on the severity of the patient's depression, patients should be treated between 1 to 3 times a week.